muscle tension, anxiety, and depression. I was finally burned out on treating chronic pain and was ready for a new adventure in my career. I made up my mind to begin a private practice in general counseling, treating all kinds of issues such as marriages, children, anger management, schizophrenia, abuse, depression, suicide, phobias, etc. I treated every problem there was in the world decently, but not well enough. I never felt as confident as I wanted to when I was treating most clients, to be honest. I was no expert in anything. I was desiring to become an expert on a specific disorder or problem. But what could it be? It was during this period of time that my father was trying to help me think of a specialty in counseling. My father and I took a trip to San Antonio, Texas, to the Texas Psychological Association's meeting to get our mandatory continuing education hours to maintain our state licenses to practice mental health in Texas. While at the conference, I had two life-changing moments. The first revelation occurred when we attended a class on the treatment of obsessive-compulsive disorder, taught by Dr. Bruce Manzabridge. He was a professor at the University of Texas at Austin, author of one of the Dummies books for OCD, and former owner and director of an intensive OCD treatment facility in beautiful Austin. That 3-hour presentation showed me that not only was OCD treatable, but it could be drastically reduced by 60 to 70% with specific evidence-based cognitive behavioral techniques. I was so overwhelmed with joy how powerful these techniques were in helping OCD sufferers recover from OCD and thrive emotionally for the rest of their lives. Lightning had struck in my soul. All of my segregated energies were collaborated into one possible purpose for my life. My father and I spoke at length about the conference and what I learned about OCD. That night and the next night at the conference, my father and I talked about the possibility of me specializing in treating obsessive-compulsive disorder in my private practice. I could be an expert in something and treat myself for OCD. I now was convinced that I could heal myself of OCD, anxiety, and depression. I also felt that I could replicate this treatment and help others suffering from the debilitating effects of OCD with a high degree of success. I spoke with my father about my desire to learn as much as I could about OCD and get any necessary certifications to treat it. We found after a search on Google that there was a 3-day intensive clinical training on how to properly treat OCD using cognitive behavioral therapy, CBT, exposure response prevention therapy, ERP, taught by the International OCD Foundation, the authority on the treatment of OCD. The teachers at the clinical training were the very best OCD clinicians and experts on planet Earth. I would now be learning from the very best. So after I completed this intensive training, I had decided that I would only treat OCD from this day on. I would continue treating all of my non-OCD clients, but all new clients would be OCD clients. I had hopes and fears of treating OCD clients all day long. What if it made my OCD worse? What if I learned to hate discussing OCD so much? What if I absorbed my clients' obsessions and compulsions? Would I be too stressed out? Or specializing in OCD treatment could be great. I could constantly learn how to properly and perfectly treat myself each day. What if just treating clients was like exposure therapy to weaken my own OCD? What if I could become strong like a powerful OCD Jedi and could will my OCD into submission? I would never know if I didn't try, so I would therefore give it a try. Did I really have anything to lose? As I specialized in treating OCD clients in